Welcome back to the MPD 101 Health Series. Last time, we talked about 6 autoimmune diseases that are more commonly known like lupus, Hashimoto's, and rheumatoid arthritis. But some autoimmune diseases don't get as much attention, even though they're just as serious and just as real. In this episode, we'll take a closer look at 6 more autoimmune diseases that are often overlooked, misdiagnosed, or misunderstood. We'll explain what they do to the body, how they're treated, and how the MPD lifestyle might help support those who are living with those trying to prevent them. Now let's discuss these 6 autoimmune diseases. 1. Multiple sclerosis. Multiple sclerosis, or MS, is an autoimmune disease where the immune system attacks the central nervous systems, specifically the myelin sheath around the brain and spinal cord. Think of it like stripping the insulation of your body's wiring. Signals slow down or misfire. Symptoms can include blurry vision, double vision, numbness on one side of the body, difficulty with balance, and severe fatigue. It often shows up in women between 20 and 40 and can be mistaken for stress, anxiety, or overwork. There's no cure yet. Doctors use disease-modifying drugs like interferons and biologics to slow progression. But these medications often suppress the immune system and can have serious side effects. From an MPD perspective, we focus on lowering chronic inflammation, supporting the nervous system with healthy fats, B vitamins, magnesium, and a gut-friendly anti-inflammatory diet. 2. Psoriatic arthritis. Psoriatic arthritis is a type of autoimmune disease that affects both the joints and the skin. Many people first develop psoriasis, those red scaly patches on the skin end, then develop joint problems years later. Symptoms include swollen fingers and toes, stiff joints in the morning, and nail pitting or flaking. It's associated with immune pathways involving IL-17 and TNF-alpha. Treatment includes NSAIDs, methotrexate, and biologics like secukinumab and adalimumab. From the MPD side, we focus on eliminating inflammatory foods like gluten, dairy, and sugar, and increasing antioxidants like vitamin A, zinc, and omega-3 fats, while supporting skin and gut health. 3. Ankylosing spondylitis. Ankylosing spondylitis is an autoimmune disease that attacks the spine and sacroiliac joints. It's most common in men under 30 and often gets misdiagnosed as back strain or poor posture. The early sign is morning stiffness in the lower back that improves with activity, not rest. It's strongly linked to the HLA-B27 gene and inflammation involving IL-17 and IL-23. Treatment includes NSAIDs, TNF blockers, and IL-17 inhibitors, along with physical therapy. MPD focuses on reducing systemic inflammation, supporting joint and bone health with minerals like calcium and magnesium, and repairing gut integrity. 4. Type 1 diabetes. Type 1 diabetes is an organ-specific autoimmune condition where the immune system attacks the beta cells in the pancreas that produce insulin. Without insulin, the body can't regulate blood sugar, and patients become insulin dependent for life. Common symptoms include extreme thirst, frequent urination, rapid weight loss, and fatigue. Diagnosis includes blood sugar testing, HbOnc, and checking for autoantibodies like GAD. While insulin therapy is essential, MPD can help stabilize blood sugar through low glycemic, nutrient-dense foods and by reducing inflammation that contributes to complications. 5. Graves' disease. Graves' disease is an autoimmune condition where antibodies stimulate the thyroid to become overactive. The immune system produces TSI thyroid stimulating immunoglobulin, which tricks the thyroid into overproducing hormones. Symptoms include rapid heartbeat, heat intolerance, weight loss, tremors, and in some cases, bulging eyes. Treatments include antithyroid medications, radioactive iodine therapy, or thyroid surgery. Some patients later become hypothyroid and need lifelong hormone replacement. With MPD, we aim to reduce overall immune stress, avoid excess iodine, support liver detox pathways, and provide nutrients like selenium, vitamin A, and antioxidants. 6. Autoimmune hepatitis. Autoimmune hepatitis is when the immune system attacks liver cells, causing chronic inflammation. It can lead to fatigue, yellowing of the skin and eyes, joint pain, and elevated liver enzymes. Autoantibodies like ANA and SMA are often involved, and liver biopsy confirms diagnosis. Treatment includes steroids like prednisone and immunosuppressants such as azathioprine. From the MPD side, we focus on reducing toxic load on the liver, avoiding alcohol and ultra-processed food, and supporting the body with antioxidants like vitamin C, E, and glutathione-rich foods. These autoimmune diseases may target different organs, but they all have something in common. They happen when the immune system loses its tolerance and begins to attack the body's own tissue. Behind this immune confusion is often a mix of genetic susceptibility and environmental triggers like infections, leaky gut, toxins, or chronic inflammation. While conventional medicine manages symptoms and slows progression, it rarely restores immune balance. That's where MPD comes in to support the body's ability to heal by lowering inflammatory load, improving gut health, and rebuilding resilience. Have you or someone you know experienced one of these lesser-known autoimmune conditions? Which one surprised you the most? Leave a comment and let me know what you'd like to hear more about in the next episode. In MPD8, I'll respond directly to your questions and comments. If you found this helpful, please share and follow the MPD 101 Health series for more.